Hello, today I will be presenting you my exercise prescription for my client, Mattias Camilleri, a 45-year-old male with a stable coronary heart disease. Mattias works as an accountant and leads a sedentary lifestyle. About a year ago, he suffered a heart attack, but has since received medical clearance from his cardiologist to resume physical activity. As medicine, he takes beta blockers, so I will use the RP scale to monitor his intensity during the session. The main goal of this session is to improve his upper body strength and his aerobic endurance, while obviously maintaining cardiovascular safety in line with the ACSM and WHO guidelines. Before the session, I will make sure that I will send the client a PRQ form which he will need to take to his doctor to fill up before the session takes place, so that he can be cleared and I can be also safe for anything that might occur during the session. In this PRQ form, the doctor needs to make sure that he measures his blood pressure, his resting heart rate, and also checks for any symptoms in relation to his heart disease. I'll also continue to monitor during this session using the RPE scale and check for any signs that might occur. The session will be stopped immediately if Mattias suffers from any type of breath loss and pain in his chest. The venue of the session will be done in a local gym using dumbbells and normal weights. So now I'm going to explain the exercise program, starting off with the warm-up. The warm-up will be around 10 minutes long. Starting off first, he will do marching on the spot, and then followed by some dynamic exercises that will help him activate his upper body muscles. These exercises are arm swings, shoulder rolls, and arm rolls, which will help him obviously target this area of the body. These exercises, I want him to do it for around 2 sets. But obviously if he feels some kind of pain, he can reduce it down to 1 set. The intensity of these exercises should not exceed the 50 to 60% of his max HR, and the RP of around 1 to 2, so that the intensity levels are not high as he's about only going to start the session right now. So now I'm going to be explaining the main part of the session, which is going to be the upper body strength part. In the main part of the session, I will focus on the resistance training, mainly on the upper body strength. This is because according to the ACSM guidelines, resistance, or also known as strength training, will help people like my client who suffers from a coronary heart disease to improve their posture, their cardiovascular load during daily activities, which will obviously come in helpful in his daily life. The 4 exercises that I will be giving my client are the seated bicep curls, the seated shoulder press, the dumbbell chest press, and the dumbbell rows. These exercises will mainly target the upper body and also will work the back as well. During these exercises, it is important that I monitor him constantly and make sure that if he feels any kind of pain or any symptoms such as loss of breath or chest pain, or even if he starts to feel dizzy, I will stop the session and do not force him at any time to continue to do the exercises. In between these exercises, I will give my client around a minute to a minute and a half to rest so that he recovers well. And I will also instruct him to do these exercises of around 2 to 3 sets each and 8 to 10 repetitions per exercise. If at any moment I can see that he is struggling, I can maybe reduce the repetitions so that I will help him obviously to recover a bit. Target intensity during these exercises are for around 60 to 70% of his max HR, and the RPE of around 4 to 5, so that it is safe all the time and I don't risk anything with his condition. So now moving on to the final stage of this program, which is going to be the cool down. The cool down is going to take around 10 minutes as well, like the warm up to complete, in which I will instruct my client to do some static stretching, like for example the cross body shoulder arm stretch, and I will also include deep breathing for him for the final part of the cool down. The deep breathing is important so that we follow the ACSM guidelines, which state that the gradual recovery post-session helps to avoid any kind of dizziness and hypotension, which obviously for a client who suffers from a heart disease like mine, it is important to keep in mind. So now I'm going to demonstrate the warming up. So the first exercise is going to be marching on the spot. So it's important that his feet and his hands are working against each other. So he can do this, and while he is doing this, he can also start to do the dynamic upper body stretching, which are arm circles, which you can do 10 forward and 10 back. Then you can move on to shoulder rows. So the same, 10 forward and 10 back. And then you can move on to do the arm swings. So we can do this as well for 10 repetitions. So now I will demonstrate the main part of the session, which is the strength part. So first off, I will start with the dumbbell bench press. So some key tips to keep in mind while doing this exercise is to keep your feet grounded and don't lift them while doing the exercise. Also to have the palms facing forward and not to the side or backwards. Exhaling to press up and inhaling while lowering the dumbbells. And also to keep in mind, it's important to not arch your back at any time. So palms forward, up, 2 seconds, hold, and lie down. So now I will move on to the second exercise of the session, which is the single arm dumbbell row. So some key tips for this exercise is to support one knee and hand on a bench, to pull the dumbbell towards your waist, so around about here, keeping your spine neutral, exhale as you lift and inhale as you go back down. This exercise helps to build back strength and also with posture. So I will grab only one dumbbell, one hand on the bench, one knee. So now I will demonstrate my third exercise, which is the overhead dumbbell shoulder press. So the same, some key tips. Obviously this exercise is done in a seated position. Press the dumbbells over the head without locking the elbows, obviously. Inhale as I go down and exhale as I press up. So in a seated position. Go up. So now I will demonstrate my fourth and final exercise, which is the dumbbell bicep curls. So some key tips as well to do this exercise is to hold the dumbbells by the side, the palms facing up, flexing the elbows while exhaling, then slowly lowering. And also important to control the tempo and not swing or take strength from your back to avoid any injuries. So, the dumbbells by your side, up, so now I'm going to demonstrate the cool down of this session. Cool down is important to do after every session because obviously during the session your body temperature is higher than normal and your blood vessels are also widened. So if you stop too fast and constant, you will get the risk of feeling sick or even passing out. So the first exercise that I will instruct my client to do is going to be the overhead stretch. So it's important to hold for around 20 to 30 seconds on each arm. So starting off with the right. And then moving on to the left. Then the second exercise that I will instruct my client to do is going to be the cross-body stretch. So I hold my arms like this and stretch the opposite direction. This will also be done for around 20 to 30 seconds on each arm. And then for the final exercise, it's going to be the wall stretch. So basically, you find the wall, stretch one arm, you hold your hands on the other side, and stretch. And hold for around 20 to 30 seconds. And then rotate on the other arm. So now I will talk a bit why these exercises will benefit my client who suffers from coronary heart disease. So each of these exercises that I have selected play an important role in improving his overall functional strength, his cardiovascular efficiency, and his overall health. The reason being is that he obviously needs and wants to improve his overall physical level, and he wants to try and start doing some form of exercise. So now I will go into each exercises. So starting off with the dumbbell chest press. This exercise helps to strengthen his pectoral and tricep muscles. These muscles are used in everyday situations. So improving his upper body strength will reduce relative effort when doing daily tasks, and it will also help to lower his cardiac strain during normal activities, and it also promotes better posture and chest expansion, which can aid better breathing efficiency, which is obviously important due to the condition that he has. Next, the single arm dumbbell row works the back and the biceps. So by doing this exercise, it will help him to improve the postural alignment and scapular stability. So coronary heart disease patients often develop rounded shoulders from inactivity or prolonged time without doing any form of exercise, which can limit his breathing capacity, which obviously is not beneficial for him. This exercise corrects this imbalance while maintaining a moderate workload that is safe for him and for his breathing. The seated dumbbell shoulder press develops the deltoids and upper arm strength. Strong shoulders will help him to be able to lift things on a daily basis, and by performing this exercise seated, it keeps the blood pressure stable, and it also reduces the risks that he might feel dizzy while doing it. The dumbbell bicep curl will strengthen the front of the arm, and by doing this, it will improve his functional capacity for tasks like lifting and carrying objects. It is performed at a slow and controlled tempo so that it keeps the blood pressure responses to a moderate. So now I will explain the acute physiological responses. So starting off with the cardiovascular response, the heart rate and stroke volume increases to deliver more oxygen to the working muscles. In clients which suffer from coronary heart disease, like my client, this response is moderate due to the medication that my client takes, which are beta blockers. The respiratory response, breathing rate and depth increases to enhance oxygen uptake and carbon dioxide removal. This helps maintain the aerobic metabolism during moderate intensity work, such as my session. muscular response. Active muscles experience greater blood flow when working during the exercises, and also the temperature rises, so this will improve elastically hemodynamic control. Systolic blood pressure rises moderately with resistance exercises, but diastolic pressure should remain stable. Controlled breathing prevents excessive pressure spikes during any form of exercise. Recovery phase: as the exercises end, the heart rate and the blood pressure gradually return to the resting levels. Cool down also helps to prevent blood pooling. These responses demonstrate safe, positive adaptation during exercise for clients with coronary heart disease, provided that exercise remains at a moderate intensity and symptoms are closely monitored. So meaning that during the exercise, my client doesn't keep on going if he experiences any symptoms such as chest pain or he loses breath during any exercise.